My Planet card.
Welcome to this webinar on asthma and how the AfriSpacer can help you. Brought to you by the Allergy Foundation of South Africa that you can see online at www.allergyfoundation.co.za. I'm Mike Levine, I'm the head of allergy at Red Cross and I'm a children's hospital in Cape Town. And I'm also the CEO of the Allergy Foundation of South Africa. And with me, I've got an amazing group of people. I've got Riaad Moosa, a doctor, stand-up comedian, actor, and podcaster. I've got Florence Masebe, who is an asthma sufferer, but also renowned as an actor, author, and producer. I've got Prof. Heather Zar, one of my ex-bosses, a pediatric pulmonologist and a global leader in child health. I've got Gokul Nair, a biomedical engineer, a founder of Impulse Biomedical, and myself and Luani Sufla are joining you from the Allergy Foundation of South Africa. So we're about to have some discussion. We're going to answer all of your questions, and we're going to give away some AfriSpacers to live attendees. So some housekeeping. First of all, stay online, tell your friends quickly, give them a WhatsApp, tell them to join us online quickly, but also feel free to ask questions live in the chat. Those questions are being monitored and sent to us, and we've got specific times in which we're going to answer those questions. And then to get your free AfriSpacer, send an email to luani@allergyfoundation.co.za with your name, your surname, your cell number, and the location of your closest SPA pharmacy. And she'll be in contact with you, making arrangements for you to be able to get your free AfriSpacer from your closest SPA pharmacy. I wish it was Oprah. Here's one for you, here's one for you, here's one for you. But we're going to give them away only for people who email her during this live link on your platform. So to kick things off, I'd like to introduce Riaad Moosa. Riaad, you all know, he's known for his comedies, he's known for his movies, he's known for his podcasts. But what some of you might not know is that his whole family are doctors. He's got him, his mom, his dad, his sister. I don't know, apparently there's one other brother or something. Riaad, is that the black sheep of the family? I'm not sure about that.
Yeah, my brother actually did the actuarial science and finance, right? So he studied something very different, but he ended up working in a hospital. So I'm out of medicine, studied medicine, don't remember anything. I don't know why you're asking me to give advice about the AfriSpacer.
Well, I hope you remember something, Riaad, because I've got some medical questions for you.
Okay.
So why do you think asthma is important in South Africa?
Okay, first of all, in Cape Town, it's pronounced asthma.
Of course.
I'm not sure you're aware of that, Prof. Asthma. Asthma, as far as I know, it's extremely common. It's apparently like 20% of kids and 10% of adults have asthma. And the big thing about asthma, symptomatically, it's preventable. This is the problem, bruh. If people just used the medication properly, it could prevent, I don't know, what percentage of the admissions into a Red Cross hospital and the multiple hospitals across the country, right? But if it's used as in a preventative way, effectively, right? It's much better. People don't understand they must use like the metered dose inhaler and the spacer as a prevention and not a treatment, right? And that is the problem. That's what we want to get out to people. And it starts with events like today, right? We give away free stuff.
Absolutely.
Right? That's the best thing to do, I guess.
Giving away free stuff is always important, but also getting that message across. So getting people to, you see your auntie and your uncle, they're sucking down that asthma spray and they're using it every day and they're like getting tight chest. And you say, just use your preventer regularly and you won't have this problem. And still they won't do this. What's wrong with Cape Townians? I don't know whether it's the rest of the country, but Cape Town seems bad, Riaad.
Yes, but I think it's going to be better once they utilize it with the AfriSpacer. I think so, right? And the best thing about this is affordable, right? And I think, like, I mean, I don't know much about the history of this device, right? But I'm looking forward to the detailed stuff that is going to be expounded upon very, very soon.
We're going to get to the history of the device in just a minute when we hear from Heather and Gokul. But I've got a question for you. You said you forgot everything in medical school, but can you at least remember being in medical school? And the direct question is, can you remember ever being taught about the best way in which medicine should be used and why you should be using a spacer? Were you ever even taught that?
I actually think I was taught that, like, believe it or not, because as far as I can remember, if you just use the meter dose inhaler, like a lot of times it hits the back of the throat and it is not distributed properly in the lungs. That's from what I can remember. I always get very surprised when I can remember any medicine. I get like a pat myself on the back. Yes, well done, Riaad. Well done. The 6 years of medicine and countless like hours studying did not go to waste. I had to wait for like 20 years after medicine to have a live Facebook asthma event to talk about like a very, very minute part of asthma. So it's worthwhile.
So to renew your certification and make sure that you remain qualified as a doctor, your qualifying question, Dr. Moosa,
do I get CPD points for this?
You get CPD points. You get double CPD points, bro. Why are spacers important?
I think it improves sort of the medication delivery into the lungs. Okay. First of all, I think I think that it's called spacer specifically for that reason, create space, right, between the medication and the lungs, and it allows for the droplets, all the medication be broken out into tinier droplets, right, and gives us more opportunity, especially for kids, right, to inhale all the medication. A lot of times, a lot of it is lost, and just this is a very, very simple device. Is very, very effective in terms of delivery of the medication into the lungs.
Absolutely. So Reese is going to show us a quick video, and then we're going to be moving on to Heather to talk a little bit about the low-cost bottle spacers. Reese, cue the video.
Inhalers contain the medication needed to treat your asthma, but the medication must be delivered to the lungs. The AfriSpacer is a spacer device which slows the speed of the spray down and helps you to get more medication into your lungs. A spacer is recommended for all children and for adults with difficult to control asthma.
So as you've heard, spacers are important to improve the delivery of medication to the lungs. In fact, the AfriSpacer and other spacers can increase your delivery by 1.7 times. So you almost double the efficiency of delivery of medication to the lungs, and you almost completely remove the side effects of having the medicine deposited at the back of your throat. And the person who came up with the idea of doing low-cost bottle spacers was Professor Heather Zar. She's the chair of the Department of Paediatrics and Child Health at the University of Cape Town. She's the director of the Medical Research Council Unit on Child and Adolescent Health, and she's the original brain below low-cost bottle spacers. So Heather, could you tell us a little bit about how the low-cost spacers came about and whether they work as well as these fancy ones?
Sure. Good evening. Hello, everyone. And thanks, Mike, for that question. And Yes, the answer is, it was about 25 years ago. Now I'm showing my age. That I was working at Red Cross in the passage, as it was then known, the emergency room. And what I noticed is lots of children coming in with asthma attacks, and they were being given medicines by mouth, theophylline, even salbutamol, which is the same as the medicine that is in the inhaler, but the syrup. And one of the key reasons why that was happening is there wasn't an affordable spacer that children could use. As Riaad has said, these spacers are really important because if you think about it, to get the medicine into the lungs, you need to push the inhaler and breathe in and hold your breath at the same time. Now, not only children can't do it, most adults can't do that. The elderly can't do it. So it's really essential to have the spacer between the pump and one's mouth, as Riaad said, to hold the medicine and allow it to get into the lungs. And so we set about thinking about, well, how could we get a low-cost spacer made? And that's when we hit on the bottle. And yes, it's, as I said, 25 years ago. It's been an amazing journey. We started off collecting bottles at Red Cross. We investigated different size bottles. We hit on the 250 ml bottle, which is the right size for the amount of medication and for the size of children and so on. And it was a really incredible journey. I was very lucky to work with very committed people. One of the key people was Eugene Weinberg, who was head of the allergy clinic at that time. And then there were people at Red Cross, one of the nurses who led the asthma clinic, Jerry Brown, was very, very much involved. And then we had even the handyman at Red Cross, Christopher Green, helping us. And gradually over time, we developed this design. And so we took these bottles, we washed them, we scrubbed them. And first we started off by cutting a hole in the bottom, the same size as the inhaler. And then we realized, hey, let's make a wire mold, heat it, the mold being the same size as the inhaler. We heat that, the plastic melts, and you put the inhaler in, and it fits very nice and snugly. And that's how the bottle spacer was born. And it sounds simple, but in fact, we did very sophisticated testing to show that this spacer, this humble, low-cost device, works as well as any of the commercially produced devices. We did sophisticated, for example, aerosol deposition studies that was done with Professor Mike Mann, who was head of nuclear medicine. We showed that as much medicine gets into the lungs when you use the bottle compared to a commercial device. We did other studies of, for example, infants or older children who came to Red Cross with asthma attacks, giving them the pump through a bottle spacer and then through commercially produced devices. And we also trialed another homemade thing. We used a polystyrene cup, and we measured how they responded. We did lung function, so really sophisticated testing, and we were able to show quite categorically, and it was really wonderful to have this result, that this bottle spacer worked as well as any of the commercially produced devices, unlike the polystyrene cup, which actually didn't work well at all. And that's for various reasons. And so, then we had something that every child could use from across all walks of life. Obviously, this was very valuable in poor settings where a commercially produced spacer couldn't be afforded, but it snowballed. And for example, it was included in global guidelines like the WHO guidelines or the Global Initiative for Asthma guidelines, and actually quite widely taken up. But we were always a little bit hampered by not being able to produce these bottles at scale. So, Jerry was producing a large amount in the allergy clinic, and Christopher Green was helping with making of them, and others were helping with making. And we wanted people to make them themselves, and we did not patent this because we wanted to be very widely available and free. But there was never a commercialization of this to make it widely available. And that's probably the big step forward. Well, I'm sure others will speak about this, but having this widely available now is a great step forward.
Yeah, so that's one of the motivations to getting your idea developed and commercialized, And, you know, we've had an amazing journey in the last few years with COVID and having to suddenly produce lots of spaces to be able to give them away to the public health service. We gave over 100,000 spaces away that we'd manufactured during COVID, and then went on to some further iterations of improving the way that they manufactured so that we could do it at scale with help from Polyoak Technologies and from the guys at Habitat. And we're fortunate enough to receive some funding from Elmer Philanthropies, the Water Institute of South Africa, and Grundfos to establish the process of, you know, manufacturing these very, very cheaply and at scale, so that that dream of getting low-cost spaces widely available to everybody who needs them across the country can really be adopted, well, not worldwide. Maybe one day we'll take over the world. You can buy your spacer at SPAR pharmacies and at the local choice pharmacy. Guys, please feel free to put in your questions into the chat box, and they'll be sent through to us so that we can answer those questions. I've received a question from Bonita Moses, who's following us on Facebook, who's asking, I guess, Heather, maybe you could comment on that, about whether adults can outgrow asthma, and is there any better way of treating asthma apart from the inhalers and the tablets?
Okay, great. So it's true, adults can outgrow asthma, but it often comes back later in life. So, you know, this period of asthma in childhood, and then it goes away for a while, but then frequently comes back. In terms of asthma treatment, I must say, I think we are at a fantastic time in terms of asthma management. We have excellent therapy available. And the best therapy is inhaled therapy, not tablets, because as you can imagine, it gets to where the medicine's needed, in the lungs. The problem with asthma is inflammation and obstruction and closure of the airways. Two problems. And you need medicine to get down there to actually open the airways and reduce inflammation. And undoubtedly, a metered-dose inhaler with a spacer is the best way of getting that medicine down, even compared to, for example, a nebulizer. You actually get a lot more medication down from a metered-dose inhaler spacer than from a nebulizer. And you'll see that in the dose. The dose in a metered-dose inhaler in a pump, asthma pump, is much lower than that in a nebulizer. For that reason, the medicine gets to where it needs to go. So we have fantastic treatment to control asthma. I would go so far as to say 98%, maybe even 99% of children, adults should have asthma that is well controlled. Everyone, almost everyone with asthma should have a completely normal life, be able to do sport, be able to go to school, work, exercise, because we have such good medication for keeping the airways open, as Riaad said. But the caveat is that medication needs to be taken regularly if you've got asthma that is moderate or severe. And then it also has to be taken when you get an acute attack early to abort that attack. And recently, we've even seen advances with inhalers. We've got combination inhalers here now that combine a medicine that treats inflammation and a medicine that treats the airway obstruction, the muscle closing the airway. So one inhaler can actually do the trick both for prevention of attacks and for treatment of acute attacks. People who use their inhalers well generally do not have major asthma attacks, and most children and adults should have completely normal lives. We're very lucky, and with a spacer, of course, because you have to use that inhaler in the right way.
So please, folks, put your questions in the chat and we'll receive them here and relay them onto the live stream. There's a question here from Tamara, which I think is probably also best directed at Heather, saying that she doesn't want to use the steroid controller because of problems that it can cause. So she's using the reliever pump for her child instead all the time. Why is that a problem?
So it is a problem if you're using the reliever pump all the time or very frequently, because the airways, your body gets used to that pump, and after a while you don't see an effect of it. It's much better and it depends on the age of your child, obviously, as well. And so this is age dependent, but it's much better to take an inhaled steroid, which treats the inflammation in the airways, to reduce that inflammation, to get control of asthma. And in fact, the new GINA guidelines for adolescents and adults are to use a combination inhaler, which is an inhaler of a steroid plus a bronchodilator reliever in combination, both for prevention and for relief. Given the increasing understanding that we have that these two processes going on in the lungs. So just treating the muscle spasm with a reliever is not going to do anything for the inflammation and may actually mask the inflammation. So you think you may feel better, but in fact the inflammation is uncontrolled, and that's potentially dangerous overuse of a reliever. So if you're needing to use a reliever a lot with your child, then I would suggest that probably quite a bit of underlying inflammation, and that some sort of controller, potentially an inhaled steroid, is needed.
Absolutely. Using a Band-Aid for an injury instead of treating the underlying cause is never a good approach to a medical problem. So I'm going to move quickly to Gokul. Gokul Nair is the director of Impulse Biomedical, and he and his colleagues devised and then produced the AfriValve. And I'd like Gokul to tell us a little bit about the design of the valve. How does it work, and what's special about this design?
Cool. Well, thanks so much, Mike. It's such an honor to be here to speak to everyone about this. So we started working on the AfriValve a couple of years ago. I think we saw that the AfriSpacer worked pretty well, but children quite struggle to use it. Well, it works really well, but we do need to make sure that when children inhale from it, that the air from or the medication from the asthma inhaler goes directly into the lungs, and they don't make any issues in terms of controlling the breathing in and out. So the way it works is that you put your inhaler into the AfriValve, into the AfriSpacer. You push the medication down. When you inhale, the medication will only flow through the AfriValve, and when you blow out, it blows through outside of this hole here. So the way the AfriValve works is it's a three-part plastic part. There's a base, there's a mouthpiece, and then there's a silicone flap that sits here. And what happens is through the base, the air kind of flows through it into the mouthpiece, and the silicone valve controls which way the air flows through. When you breathe in, the valve opens up and allows the air to flow into the mouth. And when you breathe out, it closes and this pushes the air out this way. So the difficulty for us was finding a low-cost solution to building a valve. It took us quite a long time to build a three-part valve system because most valves have multiple parts. So we spent a lot of time doing research in various use cases. And then we found this spearhead bioengineering team, especially Andrew Curry. And we found that by using this base mouthpiece and a silicone valve, we're able to really bring down the cost of a valve. And the way it works, and I think what really took us a while to get right, is also this very simple mechanism. So if it's a bottle with a thread, you're able to simply snap this AfriValve on, and that's good to go for any bottle. So I think in combination, it kind of enhances the use of an AfriSpacer and allows children to use their space a lot better. Yeah.
Absolutely. So valves are necessary to use in young children. They're not 100% necessary in older children and in adults, but also it really is a major advantage for the AfriSpacer to be able to have this handy little valve that just clips over the thread of the spacer and gives people the option of using it in that different technique. So you guys spent a little bit of time devising this gadget and making it something as cool as this. So then the question that I have is, why did you decide to essentially give that intellectual property to the Allergy Foundation rather than just using it yourself and trying to make a big business out of it?
It's a good question, Mike. I think from our point of view, myself and Giancarlo, we started Impulse Biomedical a couple of years ago. We're a spin-out from the University of Cape Town. And we're a group of biomedical engineers really passionate about making a difference in the world. And the kind of big vision for us is to develop medical technologies based on needs that we find in the continent. And then the dream that we have is to develop stuff for Africa, from Africa. And we started this vision. We built various technologies, UniPen, Easy Squeezy, the AfriValve. And I think that for us, it's based on that passion. When COVID hit, there was a shortage of spaces, and that's where the Allergy Foundation stepped in and produced 100,000, and we wanted to do our part. And I think we kind of sat together as a team. We're like, guys, we need to do something about this. And it's really cool. There was a whiteboard, a couple of markers, and people just had ideas. And then people say, no, that's too expensive. That's, that isn't going to work. Lots of ideas were thrown around. And I think because of that COVID crisis, there was a strong, passionate cause that really fueled us from the beginning. And I think for us, it made no sense to try to commercialize it. The idea is to make sure that it reaches patients that require it most. So we tried our best, work during the day, and the evenings especially would try to cut bottles, make valves, test, I think 8 or 9 different prototypes. We went through various iterations. We would find ourselves at Mike Levine's office very often saying, hey, does this work? Can you breathe through this? And we got shouted at saying, hey, change that a bit better and make it a bit better. And we finally did get it right. And we were able to bring the cost down quite a bit. And that was a really tough part. But from our point of view, it is about making a difference more than making a profit. And AfriValve for us really hits that point home.
Absolutely. And we're really grateful that you partnered with us and did a huge amount of work with helping produce those spaces during the COVID pandemic. What Gokul showed you was this guy, which is, how do I make this unblurred, put it close to the thing. This is one of the earlier versions of the AfriSpacer that was made during coronavirus, that has got a slightly different method of making the base. And we subsequently went through various iterations. This is the one up until, eventually we land up with our final commercial product, which is absolutely awesome and has got that valve attached that they were so instrumental in designing. So Reese, back over to you to show the video about the spacers and the valve and how they clip together.
The AfriSpacer can be used in 2 different ways. Younger children can use the AfriSpacer with the one-way AfriValve and breathe in and out 6 to 10 times to get all the medication in the lungs. Adults and older children can use the spacer by breathing in all the air inside with one breath with the valve off.
And I'm so glad that Florence Masebe has joined us online today. Florence is an asthma sufferer. She won the Africa Movie Academy Award for Best Actress in a leading role at the 9th Africa Movie Academy Awards, but really drew my attention not through her acting ability, but because I was amazed to see right about the time of the coronavirus outbreak, when we were producing these spaces and trying to get people to use them, she was very, very active on social media, particularly TikTok, advising people to stay calm and to use their medications and to not worry as much, but to stay home and stick to the regulations, really doing a lot of very, very good outreach and advocacy work around asthma. And it's amazing that, Florence, you managed to advise people to stay calm, even though that you've previously been in ICU with an asthma attack. How were you able to stay calm at that time?
I think because hi Mike, because I knew that not being calm was not going to help me in any way at that time. I was as scared as anybody else, probably more scared because at that time, you medics were telling us about the people with comorbidities being the first ones to go. So I knew I was at the top of that list, and having a respiratory condition meant that I was going to suffer. I was going to get COVID and not even know that it's COVID. I would have just thought I'm having an asthma episode.
Yeah, as it turned out, we were wrong, as we sometimes are about things, and we subsequently learned that asthma wasn't such a major one of the risk factors for severe COVID or for even contracting COVID, and that there were much more important comorbidities like diabetes, hypertension, pregnancy, etc. But there was that panic at the beginning, and you had a terrible experience Tell us about your asthma and about how bad the attacks have been for you in the past.
So I've had, when I was listening to Heather speaking about do adults outgrow asthma, I've had the fortune of having the asthma-free years. So when I was younger, I had a lot of episodes with childhood asthma. And then throughout most of my teenage years, did not get sick at all. And then when I got to university, I started getting sick again. And it was like, oh, okay, that thing is back. Is that what it's called? I'm asthmatic. And then it went away for quite a number of years, and to a point that when it came back, I didn't know that I was having an asthma issue. And I ended up in ICU because of that, because literally I had gone through years of not having a preventer inhaler, of not having any medication whatsoever. And if I had a rescue inhaler, I probably didn't even know where or which handbag I would have last seen it in. I hadn't needed it for so many years. I assumed I was no longer asthmatic. So the first attack that I got after those many years of not having asthma was really, really bad, and that was scary. After that, I think we've had it pretty well managed. I just get very unfortunate every now and again, getting pneumonia or getting something that comes in, and then the asthma just piggybacks along and I end up in trouble. So my last bad attack was in 2018.
So was that at the time when you weren't really on a regular controller therapy because you'd been so well for those interviewing years that you hadn't needed it?
No, not at all. Actually, I got back to really good treatment and good management after the first, I think somewhere early 2004. That is when I had not been on medication. Since then, there had been a bit of a trial and error thing with trying to see what works with me and what doesn't work with me. I had a bad reaction at some point to treatment. So we had to just start looking. But over those years, the hospitalization periods are not as frequent as what it was at the time when I had not been getting proper management.
So can you tell us about the types of medication that you've been using? Are you using a controller and then a reliever when you get a tight chest? How does it work?
So I use a controller in the morning and at night, religiously, because if I don't, I get into trouble. And I have a reliever with me then all the time, just to make sure. But when I think I'm in good health, which thankfully it's been for a while, I can go for quite a long time without needing the reliever. I'll only use it if I'm about to do something stressful, strenuous, or some exercise. I've been fortunate that it's been a little bit more controlled.
So that's perfect. That's because you're continuing your controller every day, whether you feel like you need it or not, that you're experiencing that you're not needing to take your reliever all the time. So it's that kind of delayed gratification and looking at the bigger picture story that Riaad was talking about, that fortunately you've managed to get right for you. How about your family? Has your family also got asthma? Are they affected?
So I think one of the earliest things when I had my daughter was to check when every time she had a cold, the pediatrician would say, let's just treat it, but knowing that you are asthmatic, we must also start looking out for the signs with this little one. And fortunately, I think my children had better treatment and better management of their asthma from childhood, because I, as their mother, knew the trouble of living with this chest that just closes up on you. So I was trying to do everything I could to make sure they don't go through what I went through. My son, when he was a baby, would get admitted quite often. But now he's an athlete, a professional athlete who plays soccer, uses his preventer medication and carries his rescue all the time, doesn't struggle at all.
That's exactly what we like hearing. That's perfect. But let's bring it back to spaces. Were you and your children taught about spaces? Were you guys using spaces? when did you first become aware that a spacer was a thing?
Well, I didn't know about spacers for myself when I was little. I didn't know about inhalers when I was little because I think back then everybody just treated me like I'm this child who coughs a lot at night. But with my own children, fortunately, the very first time that an inhaler was prescribed, it came with a spacer. So I've always regarded spacers as those things that help children get their medication in because they can't do the technique. I didn't know up until I got this baby that an adult can use it. So for me, I've always known about spacers, but I thought those are the things that you give to little children because they don't know how to use an inhaler for themselves.
So you only started using a spacer really a couple of weeks or months ago. And you were never taught how to use it. You were never given anything like that at all.
Not for myself, no. I've only learned now, you know. There wasn't a time when it was ever introduced to me as something that adults use. So
yeah, absolutely.
It's new to me that adults use inhalers through a spacer. And it's quite beautiful. It's good relief.
Absolutely. So we've got a comment here on the Facebook or question that says, how young can a child use this device from? And that's a really interesting question. Thanks Anissa Domingo for that question. Because we usually diagnose asthma after the age of about 2 to 3 years. You can diagnose it a little bit younger than that if it's very, very obvious. But usually at 2 to 3 years is when you make the diagnosis of asthma. And at that stage, kids can and should be using a spacer already. A little bit later, we're going to get Heather talking about the pros and cons of using nebulizers and whether people should be using valves and things like that. And whether they're going to be using face masks, those kind of questions. But I'm first going to pass over to Riaad. And again, taken back to med school, can you give us all some tips in terms of how kids should be using a spacer?
Well, in terms of my kids, what I like about the spacer, it makes it more fun also. You know, I mean, you can pretend it's so many things. I do Darth Vader vibes with my kids, upload the spacers, do lots of fun things with it. That's the cool thing about a spacer. It gives also them a lot of time to actually, you know, get into it. But the main thing with the spacer, I think, like with an adult, you know, you could actually just take one inhalation. You're supposed to actually breathe everything out, like first empty your lungs, okay? Make sure there's a tight seal around the aperture, the opening, and then, you know, press on this thing and then breathe it in one sort of breath. You can do that. But with kids, they advise you to do it, I think 6 breaths. Am I correct?
No,
and
6
once
to 10
again,
breaths is perfect.
And once again, the main thing is to keep a tight seal around the valve, right? And breathe slowly. That's very, very important. Breathe slowly, and hopefully all the medication can get in, and you know, they actually feel a lot of relief very, very quickly. So I think you know, that's what I can remember. Anything
That's
else?
perfect, Riaad. You get an 80%. You definitely get a first-class pass. Woohoo! You know, this issue of breathing slowly is something that my kids can't get their heads around because they're always in such a rush to take their pumps. They want to get it over and done with as quickly as possible. So they land up grabbing their thing, sucking it in as hard as possible, almost like they're trying to like play a musical instrument, like you said earlier. But calm and steady wins the race with many things, and it's definitely that with a spacer as well. Yeah. And Florence, you brought up this amazing point that, you know, despite being in ICU, despite being really, really having struggles with your asthma, you were never really trained to use a device. You didn't know that adults can use them. So you only received a spacer when we sent you one. So now that you've used one, what are your impressions about how it's like to use it and whether, you can feel anything in your lungs? And be honest with me. I want to know exactly how this thing is working and how you felt about it.
So there's that thing that Riaad mentioned about when you take the inhaler and the medicine hits the back of your throat. When that isn't there, it feels a lot less horrible to need to rush to this thing for help. But the one very good thing that I've discovered now, something that you and I had a discussion about, was the spacer being something that you can use to up the puffs into the spacer. And when you take it in like that, in multiple puffs, you don't need to come rushing to go switch on a nebulizer. I've never been a big fan of the nebulizer because I can't tell whether I'm getting better or not. I just really panic. So I've always preferred nebulizers only when I'm in hospital with professionals knowing what's going on with my chest. But with the spacer, I can tell the difference. I can tell that the relief is coming and I don't need to worry and we're good. So it's lovely. I just need to find like a fancy little pouch. I think you must speak to your daughter about it. I want like something sexy that I can put it in so that when I put it in my bag, I can travel with it and whip it out of something sexy. But
we'll work on a fantastic pouch for the AfriSpacer. Thanks, Florence.
Right, and you can put the Allergy Foundation branding on the pouch. Just a pouch, just for me.
And Florence has mentioned three actually really interesting and important things. First of all, she doesn't feel that effect of that stuff spraying at the back of the throat, which she finds unpleasant. But obviously what that's meaning is that the spray is going down the lungs instead of getting stuck in the throat. So you've got that increased efficacy and you've got that decreased risk of side effects. So it's amazing that you could even feel that and notice that. And you also bring up the impression that you're feeling better. And then the issue that Heather's going to talk about a little bit later, in fact, really just after this, is about using an asthma pump as a nebulizer substitute and about actually how much better it is to use a pump with an asthma spacer rather than a nebulizer, and a little bit more about the science about that. But before we get there, I'm going to go back to Reese to show us a quick video. Please, guys, ask more questions. We've got a question and answer session coming up straight after the video.
Shake the inhaler to ensure that the contents of the inhaler are well mixed. Fit the inhaler firmly into the AfriSpacer. Place the mouthpiece in your mouth between your teeth. Close your lips firmly around the mouthpiece, but do not bite it. Breathe out as far as is comfortable. Press firmly down with your fingers on top of the inhaler to release one puff of medicine. Straight away, take one deep, slow, steady breath to make sure that the medicine goes all the way into your lungs. You must inhale one puff of medication at a time. Take the AfriSpacer out of your mouth and hold your breath for 10 seconds, and then breathe out through your nose.
So for more information about the spacers, guys, please go online to www.afrispacer.co.za. And don't forget to send an email to luani@allergyfoundation.co.za if you want to get one of your free AfriSpacers that we're going to send to you at your closest pharmacy, if your closest SPAR pharmacy. So I've got a question here from Tumi Murake, who says, Tumi was diagnosed with asthma in the teenage years and it got worse and worse and worse. And they worried that because they're on steroid inhalers and pills and being overweight, that some of the asthma medication might be causing the problem. So is there medication that is better for somebody who is overweight, that is on pills and inhalers that doesn't have steroids in it? Heather, can I ask you to take this question from Tumi about taking pills and side effects from steroids?
Sure. So I go back to one of the key messages that I was trying to say before, and that is the best treatment for asthma is inhaled into the lungs using a pump with a spacer, better than a nebulizer, and we can come to that down the line. I'm not sure what the pills are, but if they are steroids in the form of pills, those have real side effects. They cause weight gain, which may be a reason for the weight gain. Your weight gain, they cause bones to soften, they can cause high blood pressure, they can cause your skin to thin. They've got a lot of side effects, steroids when taken by mouth or by injection. The doses are much, much, much higher than any inhaled steroid. And if you think about it, you take it by mouth and it gets into your tummy, and then it goes from the tummy, your tummy, it's absorbed into your blood, and then it goes everywhere else in your body. And finally, a little amount may make it into the lungs. And sure, maybe your asthma will, and it will help your asthma, but you will get a lot of side effects related to dose and related to how long you're on steroids. We try at all costs to avoid steroids taken by mouth or by injection. The best way to deal with the inflammation, the redness that is in those airways for people with asthma is through an inhaler, where the dose of steroids is a microgram. If you think about what's in a prednisone, as an adult, you usually get prescribed 40 or 50 milligrams. What you're taking in an inhaler is anything from around 400 micrograms, tiny, tiny doses. And if you use a spacer, as everyone has alluded to before, what happens is the big particles get deposited in the spacer, so they're not in your mouth, they're not in your throat, and only those little particles, about 20% of what is in that dose, get down into the airways and treat the inflammation where it's needed. So it's very minute doses, it's very safe, and it's very effective. And that is the best way to treat inflammation from asthma. Sometimes it's necessary to use oral steroids for someone, Florence will know this, with a bad attack. Oral steroids can be life-saving. That's for someone with very, very, airways that have closed a lot and there's a lot of inflammation and you can't actually get inhaled medicine down. So sure, oral medication can be life-saving, but for most asthma sufferers, the way to deal with the inflammation and to keep it down and your asthma controlled is by using these microgram doses in the asthma pump with a spacer. Just to also emphasize a point that Mike made, and I think Florence, you also made this point. The other advantage of a spacer is those big particles don't get into your throat or mouth. So a side effect of inhaled steroids is sometimes thrush. People will say, that whiteness that you see in your mouth. And a spacer prevents that because those big particles are deposited in the spacer, not in your mouth. So really, a spacer is very effective for minimizing side effects and for getting the small particles that really need to do their job into the lungs.
So the answer for Tumi is to make sure that they're using their asthma steroid inhaler regularly with a spacer and with the best possible technique, and not using pills all the time. But if there's still symptoms, then they need to see their doctor to kind of find out why, because most asthma should really be controlled well with that amount of therapy. I've got a great comment here.
Mike, sorry, can I add to that?
Yeah, of course, Heather.
Can I just add to that? Because the other possibility is that you're on an oral bronchodilator, oral salbutamol or something, which is a reliever. And there are still, theophylline, oral salbutamol, those sorts of medicines are also sometimes given to open the airways. And the same applies. It's much better to take salbutamol, which is the reliever, through the pump and spacer than to take it by mouth. You'll get lots of side effects by mouth: shakiness, jitteriness, heart rate will go up. So we're very fortunate. We've got much better ways of delivering asthma treatment now.
Yeah. We've got this comment from Claire Villiers, who says, my son says the inhaler shoots him in the mouth and it's so cold. So eagerly awaiting ours. And that's just an example about how the kid has noticed that this cold spray is going into the back of the throat and causing a problem. There's also a comment here from Lauren Foss about her son who's got asthma. Unfortunately, she doesn't give us the exact age because, the guidelines might differ depending on the exact age, who has asthma that is mostly bad in winter. Should they be taking an asthma pump every day, or is it okay to only take the pump in winter when it gets bad? What Lauren does not comment is whether they are taking a steroid pump or a reliever pump. So we don't have all the information we need. But what about people who are getting symptoms not all the time, Heather? What do those people do?
So actually asthma worsening in winter is very common, because especially in children, because one of the major things that cause children to get asthma attacks that rev up that inflammation is viral infection. And we heard from Florence and others, and and how worried people were about COVID causing that revved up inflammation, which fortunately it didn't. But you can expect your asthma to be less well controlled in winter when there are a lot of virus. Well, at least children can expect their asthma to be less well controlled when there are a lot of viruses around. There are some people who only have seasonal symptoms, and for them it is okay to take that controller with the reliever as needed during the seasonal period. But be I would just caution you that often parents and children learn to live with their symptoms. So they learn to live with a child who maybe doesn't take part in sport as much as he would, because he starts coughing when he's running. Or they learn to live with some waking at night because of coughing. And the symptoms are often under-recognized. So just make sure that your child truly is not getting symptoms of asthma through the rest of the year too.
Absolutely. All right, so we're going to move on a little bit and discuss, there is a question here that I'll get to in a minute and maybe discuss that with Heather. But there's a question, the question that I've got for Heather is about the different types of spacers that are on the market. There are different sizes, there are different materials, that there are some that are made out of plastic, some that are made out of metal. Does it really make a major difference what the spacer is made out of? What do you look for in a good spacer?
So most spacers, most commercially produced spacers are made of plastic. There are some made out of metal. The reason for that is to reduce the electrostatic charge on the side of the wall so that the medication doesn't stick to the walls. But there are ways of dealing with that with a plastic spacer. You can make a non-electrostatic plastic spacer. And actually what we did in the original 25 years ago was we washed the spacers with detergent and water and allowed them to drip dry. And that actually reduces the electrostatic charge on the sidewalls very effectively. So most spacers, most commercially produced spacers are much of a muchness. As I said, the bottle spacer works as well as these commercially produced devices. You want a spacer that is not too huge, because if you think about it, as Riaad, Florence, and others have said, you want to clear that spacer of the medication in a few breaths. And if you've got a huge volume, think about it, you use, let's say, a 2-liter bottle, a little child breathing in that will only breathe a very small proportion of the air in that spacer. And that's why, in developing this kind of hose, and Florence, you said you only want a nebulizer in hospital. Actually, you want a spacer and pump in hospital as well, unless you're needing oxygen, in which case, you go with a nebulizer. But there are very many studies that have shown the amount of medication that gets into the lungs from a spacer with a pump is more than from a nebulizer. And you can think of, you'll know yourself, when you put a nebulizer in your mouth, you see all the fumes around your mouth, or it's getting lost in the air. It's not going into the lungs. And for little children, using a mask over their nose and mouth with the spacer and the pump is the way to go, rather than a nebulizer with a good seal. The other thing is there are less side effects from a spacer pump than from a nebulizer, and that's because you get more deposition in the mouth and more systemic, more absorption into the body when a nebulizer is used. So really using a spacer with a pump is the way to go in all situations, and it's really empowering. I mean, you think about children in the poorest of circumstances. Take out, if you're feeling your chest is tight, use the AfriSpacer with a pump. You should get relief quickly, and you don't need electricity. You sitting in the dark, I think, Florence. We all know the issues of power in our country. That's another problem with nebulizers.
Absolutely, but the problem is that, and Riaad will confirm this, that every time he tells us, but man, the nebulizer works like a bomb, and the asthma pump doesn't work on my child, so I need to get that nebulizer. I must use a nebulizer. What's the reason for that, Heather? Are we comparing apples to apples when we are comparing nebulizers with metered dose inhalers? Why does every grandmother think that the asthma pump doesn't work as well as that nebulizer?
I think part of the reason, Mike, is that the asthma pump hasn't been used properly. It often isn't used with a spacer. It's not the asthma pump. It's got to be the asthma pump with a spacer for a young child. It's got to be a good seal for a young child, either with a mask or held in the mouth. And people like the noise that the nebulizer makes, and it seems impressive, but don't be deceived. Really, there are so many studies that have shown that the use of a spacer and pump as effective or more effective than that nebulizer. And the nebulizer cost is much, much more. I mean, as I alluded to before, you're putting 10 times the amount of medication into a nebulizer than you're using in a pump.
Yeah, so I guess if you're comparing, using a nebulizer, which is 2.5 milligrams, versus using a pump, which is 100 or 200 micrograms, you're using sometimes somewhere between 12 and 25 as much medication in your nebulizer. And then even if most of that goes into the air, it still feels as if it works better because you've just used so much of it. So it's really a dose effect. And that's why when we talk about multi-dosing, and Florence was alluding to this, and you'll see in a little bit in the video, when you're talking about multi-dosing, it's important to use more than one puff. For a severe or a moderate to severe attack, somewhere between either 4 to 10 puffs, depending on the age and how severe it is, but separated one puff at a time into the bottle and then inhaled fully in order to get as good effect as a nebulizer. So we do want to tell those people that are commenting, people like Babalwa, Mene, no, it is most definitely not necessary to get a nebulizer for your 3-year-old. It is in fact better and more effective to use your pump with a spacer than it is to use a nebulizer. So I want to quickly introduce my friend and colleague, Luani Sufla. Luani works for sales and marketing for the Allergy Foundation of South Africa. And Luani, can you tell us about how people should look after their AfriSpacer? Heather was talking about washing and special ways, things that you have to do. Is there any tips that people need to know about taking care of their AfriSpacer?
It's quite simple. It's ideal to replace your AfriSpacer after 12 months of use, especially if your AfriSpacer is used daily. To clean your AfriSpacer, you can just use a mild detergent, wash it with warm water, mild detergent or a sterilizing solution, and preferably to keep it clean twice a week. The AfriSpacer also needs to be drip dry, as Prof. Heather was saying. Please do not use a cloth because it causes static and that can affect the asthma medication going through to the patient's lungs. So it's quite simple to keep your AfriSpacer clean, and please remember to replace it every 12 months after use.
So Spongile Mwala Pungula asks, does the AfriSpacer fit into all pumps? And this is a great question because you will all know that because it's made out of plastic, the aperture at the base of the AfriSpacer has got this very specific shape to us. Ours has got these little ribbed margins in it so that we can get a firm grip of the asthma pump and not have any leakage. So most asthma pumps will fit into the AfriSpacer. There are actually 2 different asthma pumps that are available in South Africa at the moment that do not have a standard shape nozzle on them. And I don't know why these people decided to have an abnormal shaped nozzle on their asthma pumps, but that particular pumps will not fit into the AfriSpacer. And the only spacer that they would have been able to fit into has actually been discontinued in South Africa and is no longer being sold or marketed. So there isn't actually a spacer now available that has got a different size aperture. They're all exactly the same as the AfriSpacer. Every spacer that's available in South Africa has the same nozzle, and those 2 asthma pumps, unfortunately, will not be able to be used by a spacer, and that is a disadvantage for them. So, Luani, how can people get hold of their AfriSpacer? Where can they get them, and how much do they cost? Luani, are you there? Luani looks like she's frozen, so I presume if she's frozen for me, she's frozen for you. The AfriSpacer is available at your local choice pharmacy and at your SPAR pharmacy. We're actually going into an arrangement that you guys will have heard of. If you send Luani an email at luani@allergyfoundation.co.za, she's going to be liaising with you. Pop in your name, your cell phone number, and the location of your closest SPAR pharmacy. She'll be liaising with you so that you can get your complimentary AfriSpacer delivered to you next week after we launch. And we have managed to get these, that they are covered by some medical aids. So those of you who are lucky enough to get medical aids can even get them through there. So I'm going to close and hand over to everybody for a quick word of thanks. First of all, thank you to our starting guest, Riaad Moosa, who has entertained us for so much. Any last words from you, Riaad?
Yeah, no, thank you for having me. It's actually been very beneficial for me and my kids. 2 of my kids have asthma. And I've had the opportunity recently to utilize it. And it's proved to be very effective. And I'm very happy to assist in any way I can. And I hope I continue to do so.
Awesome. Thanks, Riaad. And we had joining us Florence Masebe. Thank you so much, Florence, for joining us and talking about some of your personal journey and experience. Any final words from you?
Thank you so much for having me, Mike. And thank you for all the information I got from you and Heather today. It's important for me to do whatever I can to make sure that other people have information that I kind of think I had to go digging to know. So the more we make everyone else know how to treat their asthma, the easier their lives will be.
Absolutely, and that's one of the things that the Allergy Foundation does incredibly well. Please go online, guys. Look at www.allergyfoundation.co.za. There are pamphlets and brochures that are aimed at patients that will tell you everything you need to know, not only about asthma and the AfriSpacer, but also about food allergies, drug allergies, rhinitis, eczema, all the other things that we do in the allergy world. There's a lot of information online at allergyfoundation.co.za. Thanks to Gokul for joining us and for sharing us a little bit about the voyage of the AfriValve. Any final comments from you, Gokul?
Well, thanks, Mike. I think it's been really cool being part of the journey, especially a part of the development process for the AfriValve. I think my last word is, I know my dad used the AfriSpacer and he loves using it. So I hope more people also get on the bandwagon and start using the AfriSpacer and the AfriValve.
Thanks, Gokul. And we lost you, Luani, just at the critical moment when I was asking you about where to get the AfriSpacer. What's the story with medical aid? People can get them on their medical aid from some of the medical aids, is that right?
That's correct, yes. The AfriSpacer has been API-coded and Discovery Health Medical Scheme members can claim for the AfriSpacer through their savings benefits as well as their hospital plan.
Great, and we're going to be working on getting all the rest of the medical aids on board as well. Hopefully they're watching this, this broadcast. And then finally, we had Prof. Heather Zar joining us, the beginning of the journey of the AfriSpacer, and now at the beginning of a new beginning, hopefully, for the AfriSpacer. Heather, any final words from you?
Yes, thank you, Mike. Thanks so much to everyone. It's really wonderful to see the journey that this bottle has come on. It's fantastic to see it becoming widely available. And I just want to say that in our experience, children loved using it. This bottle is something they know. It's not a intimidating looking funny thing. And you know what? If they break it, they can get another one. So wonderful to see this journey. And thank you to everyone who's made it possible.
Thanks so much. Don't leave right now, guys, because there's the big giveaway of spaces. So please send your details into Luani, and she's going to hook you up with your closest SPAR pharmacy so that you can get your AfriSpacer delivered to you within the next week, hopefully. And we've got a final video put together that's really going to capture a lot of the key messages that we have stressed today. So please stay online. Watch this last final video, tell your friends, family about the AfriSpacer, and have a look at us online, both at afrispacer.co.za as well as allergyfoundation.co.za. So Reese, cue the last video, and then over and out. Have a wonderful evening, folks.
When you have difficulty breathing, you need to use an asthma pump.
No, Mpilo, you need to use a spacer to get the medicine to work properly in your lungs.
Inhalers contain the medication needed to treat your asthma, but the medication must be delivered to the lungs. The AfriSpacer is a spacer device which slows the speed of the spray down and helps you to get more medication into your lungs. A spacer is recommended for all children and for adults with difficult to control asthma.
Remember what I said, Mpilo?
I shake my pump and put it in the back of my spacer. I put my mouth over the valve.
Make sure the valve is between your teeth and your lips are tightly closed so nothing leaks out. Are you ready, Mpilo? Okay, now breathe slowly and deeply all way in and all way out. 6 times, Mpilo. Well done.
My friend showed me this cool little gadget for my asthma pump. You don't have to push down, all you have to do is squeeze, and it's amazing for little kids younger than me.
The AfriSpacer is recommended for all children and for adults with difficult to control asthma. The AfriSpacer can be used in 2 different ways. Younger children can use the AfriSpacer with the one-way AfriValve and breathe in and out 6 to 10 times to get all the medication in the lungs. Adults and older children can use the spacer by breathing in all the air inside with one breath with the valve off.
I didn't know adults should also use spacers, but since I've been using my pump this way, I have better control over my asthma.
Shake the inhaler to ensure that the contents of the inhaler are well mixed. Fit the inhaler firmly into the AfriSpacer. Place the mouthpiece in your mouth between your teeth. Close your lips firmly around the mouthpiece, but do not bite it. Breathe out as far as is comfortable. Press down firmly with your fingers on the top of the inhaler to release 1 puff of medicine. Straight away, take 1 deep, slow, steady breath to make sure that the medicine goes into your lungs. You must inhale 1 puff of medication at a time and hold your breath for 10 seconds. Breathe out through your nose. If you need to take more than 1 puff, remove the inhaler, wait 30 seconds, and then repeat.
My doctor gave me an action plan to control my asthma. I've got 2 pumps, and the plan helps me remember which I must take only when my chest is tight, and which I must take every day.
For more information about the AfriSpacer, go to www.afrispacer.co.za or go to the Allergy Foundation website at www.allergyfoundation.co.za for information about asthma, action plans, and much more. And sign up the Allergy Foundation as one of your beneficiaries on your Woolworths My Schools, My Village, My Planet card.